How you doing, guys? Dr. Thompson here with Exemplify Health Center, your World's Way affiliate, Yorkville, Illinois. I am coming live kind of off the cuff. It is Sunday. I've been in the office for a little bit, finishing up a talk for Orlando, Florida. I'm going to be speaking at the Wellness Way seminar for a lot of doctors, a lot of practitioners, and I'm talking about the whole idea behind adrenal fatigue, if it does in fact exist, or is it actually the adrenals responding to specific stressors and inflammation. So I know that a lot of you, we want to throw around the idea behind the thyroid, adrenal fatigue, things like that. And at that event, which is for doctors and for practitioners, I'm going to help people see from a different perspective in regards to this whole idea behind adrenal fatigue. So people had asked me, hey, whatever happened to that patient in regards to the that we did blood work on at 4 weeks, after 8 weeks, and then this one's actually like a 14-week follow-up. We had done the testing back in January, but I didn't get a chance to actually go over it with this individual until like beginning of February. And then it was just, we were so busy, it literally just did escape my mind, except I saw a post that someone had asked, have you retested this person? I was like, oh, yes, we have. Excuse me. So I want to go over it with you. I'm going to show you a couple of things, because remember, the number one thing that we saw after the second was some issues with energy. We saw lower immune responses, really, really poor energy. This individual broke out in canker sores, eczema, so you knew that things like were not good. I remember I talked about the idea of secondary infections, how it actually lowered the immune response, how you actually saw lower CD4 cells, CD8 cells, which opens up for viral infection or reactivation of a virus. We tested that person again, another, I think, 4 weeks afterwards, and we saw the immune system recover. But one of the things that we saw, I'm going to show you this, was we saw incredibly high levels of what is known as homocysteine. I know I did a video on that and explained to that, the role of homocysteine with methylation and things like that. So I wanted to give you an update because we tested the person again, last results in regards to homocysteine levels and methylation. But I'm going to help tie it in as far as when people do very high levels of homocysteine due to poor methylation, some of the symptoms that they can have, because this is methylation is nothing that's extremely special. It's just that it is so important because it happens literally with so many different processes in the body. And what methylation is basically just from one thing to the next is adding a carbon and 3 hydrogens, and it's very, very important for a lot of different functions, including repair of DNA. But there's some other things regarding neurochemicals, heart, vascular health, and things like that. So I'm going to show you his last results at the end. So I want to show you just to give you a quick recap, because this is what we did on the last video of this individual. And when we look at this, and the reason why I remember this is because I'm going to actually talk about this in Orlando in regards to maybe some hidden things in regards to people think it's their adrenal glands, but it's actually can be some other things. So this one we did 11, 17, 21. You can see homocysteine levels are at 30. So a lot of vascular issues. Let me turn this back around as well. So a lot of vascular issues that are going on in relation to obviously the effect is the vascular supply, but where it's actually coming from is the liver, because about 95% of methylation is actually happening in the liver, and this is why liver health, guys, is so important. So when you actually look, because your doctors don't measure homocysteine levels yet, it is one of the leading indicators of any kind of vascular illness, or cardiovascular disease, heart attack, and stroke. But what's interesting is if you look, let me turn around again. Sorry, I'm jumping back and forth. But if you look at what the Cleveland Clinic actually says, Cleveland Clinic is what are the risks of high homocysteine levels? Well, his were at 30. There really should be at about 8 or 9. But one of the things, are blood clots, dementia, heart attack, heart disease, osteoporosis, and stroke. And how do I know if I need a homocysteine test? And here's what they say. If you experience dizziness, fatigue, muscle weakness, pale complexion, tingling in your feet, your arms, or your hands, or any kind of tongue or mouth soreness. And guys, we see this all the time. Dizziness, fatigue, muscle weakness, tingling in the hands, feet, arms. And so when you see that, it says, well, you might need to get a homocysteine test, because it's not just about your cardiovascular system, although that's where you'll see the most obvious, because it starts to affect your neurotransmitters tremendously as well. So this individual, when I asked him, I said, hey, afterwards, how did you feel? He's like, fatigued. I am extremely fatigued. I'm dizzy. I try to work out and I feel like I'm going to, pass out, or I feel like, the dizziness is unbelievable. But what was interesting too is he was experiencing, he's like, again, this was someone who was pre-diabetic, lost about 80 pounds, and started, going to our gym, literally 3-4 times a week. Tremendous progress. And he's like, I feel like I've lost all my muscle strength as well. And he said, I also developed canker sores and sores all in my mouth, in addition to having eczema, changes obviously in through the skin. So that's why we did check his homocysteine levels. And we rechecked him again with a little bit more specific panel that checks what's known as methylation as well. This is actually what it looks like, guys. So this right here is literally happening billions of times inside of your cells, and you see basically this flywheel of methionine, SAM into SAW into homocysteine, and then it gets recycled. And guys, this is why things like B9, B12, enough choline, betaine, within your diet, how that allows for proper methylation. So this is, you could see there was such a buildup of this homocysteine, and actually saw when we looked at the test, such a huge buildup, which means that he's not methylating very well, okay? Or he's not able to actually recycle that whole entire system. But look at the symptoms. Look at what methylation is needed for. You look at dopamine, serotonin, epinephrine, norepinephrine. It's needed for detoxification, vascular inflammation, and actually blood pressure. So it's not that it's unique, but it can have so many different symptoms when someone is not methylating very well. You probably have heard of MTHFR, and guys, it's not necessarily the genes. It's actually a genetic change in response to environment. But guys, if you look at, for example, how this even influences mental health, all you have to do, guys, is just look at some symptoms of actually low dopamine, and I'm looking at it right now. So if someone suffers with low dopamine, they can have depression, problems with concentration, problems with motivation, problems with memory, restless leg syndrome, which we see a lot, even tremors at rest, changes in coordination, even having a low sex drive. If you look at low serotonin symptoms, depression, problems with sleep. A lot of times what we'll see is the inability you can fall asleep, but you can't stay asleep, having chronic body pain, memory, learning issues, anxiety, guys, schizophrenia, problems with appetite, and a lot of times it's just not having hunger at all. Those can be some big time changes when it comes to changes with serotonin. But even if you're having issues in making epinephrine and norepinephrine, you can have things like lack of energy, lack of coordination, ADHD. You can have depression, all of these neurochemicals, and we measure these doing a peripheral neurotransmitter test using urine. But all of these are responsible for methylation in order for these things to be able to be made. So there's so many people who do in fact have problems with methylation, and some of the things can be a severe dietary deficiency, or they can be problems with liver inflammation as well. But you need specific nutrients in order to help with methylation. And some of these things can be things like vitamin B6. It can be things like iron. It can be things like B2, B3, B12. Making sure you have enough magnesium, enough potassium. I mean, there's a lot of different foods and amino acids that you need, like high choline foods, glycine, betaine. Guys, this is why, someone's not getting enough betaine and salt. This is why they can have problems with stomach acid production. Okay. So why we give people a lot of betaine hydrochloric acid. Some of it is actually due to helping them break down their foods, but some of it is also betaine in order to help them methylate properly, because otherwise they're going to run low when it comes to methylation, and consequently low in dopamine, serotonin, adrenaline, develop vascular inflammation, problems with blood pressure, problems with detoxification. Guys, even your hormones and your estrogens are responsible for this. So this is why he felt just absolutely just terrible after that, because he had a problem with methylation. Now, we retested this. I know that someone asked, what is the name of the test that you did? And it is called a methylation panel. It's from Genova Diagnostics. Genova does some wonderful, wonderful tests, including one of the best stool tests that we use quite a bit as well. But let me show you, because we did this test, I believe, or he took it around the middle of January, so it was about 6 to 8 weeks. And we did do some things in order to help him with methylation. Very, very specific things involving the liver. Very, very specific things, just based off of, this was a 911 type of situation that was going on. But when we look at the new ones, the two most important things, you can still see his S-adenosyl homocysteine, which is a precursor. You can see it's still elevated. We're still working on that, but you can see homocysteine levels went from, 30, and it went all the way down to 9. So you can see on these tests. So you can see still needs a little bit of work. But when we went over his test, I asked this individual, like, hey, how you feeling now? He's like, wow, I feel so much better. My strength has gone back up. My energy has gone back up. He's still dealing with some issues with mental stress too, because we're always dealing with stressors, all the time. But basically, for this individual, they say that, hey, I felt the best than I have in the last 6 months. But the problem is, guys, is that I always wonder. I'm like, look at all of the people who had this experimental therapeutic done, who aren't feeling very good, who, and again, this individual only got the initial and then the 4-week, never ever went and got any kind of booster. No way, he was not going to do that. But how many people have just continued to tear down their bodies by getting a booster and getting a second booster or getting a third booster? And I just shudder to imagine what would have continued to happen if he didn't have the right someone in his ear, but also someone who knew how to handle it. And this is what, guys, in the Wellness Way, and I'm just, guys, one office within the Wellness Way. There's 60 or 70 across the country, because people reach out to us all the time and they ask us, like, I want to work with you. And I'm like, guys, I'm not super unique. I'm not special. All these other doctors have the same perspective that I did. It just so happened that, I wanted to make sure that we were testing people after that, so that we could get some really good clinical information from it. And the people that did and that wanted help, we tried to help those people obviously as much as possible. But this individual is doing better. However, if this individual would have continued, I don't know what obviously could have happened. So we've seen a lot of tests pre and post, and we've seen a lot of tests that don't look so hot. They don't look so good. And so the problem is I just believe, and that's one of the things that breaks my heart, is I truly know that there's a lot of people who probably are suffering, who just, they don't understand why they're not feeling so good. And nobody is telling them, other than it's just in your head. And just remember, like, these levels, for example, have a tremendous effect on neurochemicals. And remember, the brain is the receiver for these neurochemicals, like adrenaline and like serotonin, like dopamine, things like that. But if you don't methylate very well, it's very hard in order to make these things, which is why so many people will have problems with sleep, fatigue, depression, schizophrenia, bipolar, things like that. And that's one of the first places we always look is in regards to methylation. Not something that's unique in the body. It happens so many times. But if that suffers, there's so many different body systems that will start to suffer as well. So this person's doing better. I'm just happy that we were able to work with him as well. We'll continue to monitor. We'll continue to test him, as well, because that's something that this person is committed to. Is committed to getting tested once or twice every single year, and to keep working on their health. That's one of the most important things. So, guys, just my quick update. This is, I think, comes out to about 14 weeks or so after the second. Don't quote me on that. But you can see that a lot of those levels started to return to normal, but it wasn't that he just did nothing. He did some very specific things that we did based off of testing as well. So, and that's why I thought of it, because it's one of the slides that I have in my upcoming talk coming up next month down in Orlando. And it reminded me that people had asked, but I have been so busy over the last 2 months. It's been absolutely crazy, absolutely great, and it's also been a blessing and a curse, obviously, at the same time. So I'm catching up, which explains why I'm here on a Sunday. All right, guys, I always appreciate you guys watching. Please share this video with others, and the more that we can help people, that's why we do it, is to help people and to literally save lives. That's what my purpose in life is to help people, to save lives, to give them a different future, a better future especially. So, guys, I'm going to head out of here. I'm going to head home. So we'll talk to you guys soon. As far as the question and answer, thank you those people who submitted questions. We had a lot of them. I picked out not all of them, but some of them. And instead of doing it tonight at 5 o'clock like I promised, if it's okay, I want to do it tomorrow after I see patients. So probably about 7:30. We got a lot of great questions. Awesome questions, and so stick around for that. Tomorrow will probably be about 7:30, and we'll answer, I think we got about 7 or 8 really, really awesome questions that I know that will pertain to you. So guys, be well, be blessed. Make sure you share this video. I always appreciate it. We'll talk to you soon.